Okay, we're going to give you some numbers here to start off. It's estimated that in every 10,000 people, between 1 and 4 have some sort of scleroderma issue. I hope I said that right. We're confused about what it is. We want to know. It's a very big problem.
Yes, it's a serious skin condition, and joining us this morning to talk about this is Dr. Bahman Guyuron, a plastic surgeon with Case Medical Center. Thank you, doctor, for coming back on the show.
Thank you so much.
It's great to be here.
What is scleroderma?
Scleroderma is a condition where the patient's immune cells attack the patient's other cells in different parts of the body. And the clinical presentation is stiffness of the skin. The skin becomes firm and like scar tissue. The patient cannot move the hand or bend the fingers or move the lips smoothly and softly. Wow. So it is a very utterly disabling condition. I
mean, you hear that and you're immediately scared, you know? It's
right.
Very serious. So you're conducting a study about treatment for this.
Correct.
And what is that?
In animals in the lab, we have been able to create a similar condition like scleroderma and reverse it using fat that contains stem cells. Injecting fat in the area containing stem cells can reverse that condition. We have now started doing this on human beings.
Wow.
Who would be a candidate for your study? Because I know that there's a common skin treatment out there, skin disorder. Is it Raynaud's syndrome? Is that a part? Is that a part of this scleroderma?
It is, and it is actually a part of the clinical presentation. Patients who have this condition, their fingers go blue when they are outdoors in a cold environment. That happens only when it is cold outside or when they touch ice. So the patients who have that kind of symptoms and stiffness of the skin or hands are the good candidates for the injections that we're doing.
Yeah, we're so fortunate to have such brilliant doctors in the area to do what you do. What led you to think of something like using stem cells, fat stem cells for treatment?
We've been making observations over the years that when we inject fat in the radiated area, meaning area that has been treated for cancer, when the patient receives radiation, can also become stiff and firm. Mm-hmm. We've noticed that actually when we inject fat in those areas, it becomes softer and more like normal skin. So we have taken that information to the lab, and now we're back to the clinic to apply the same principles to see if we can make the patient's skin softer, and we're getting good results.
Right, and we only have about a minute left, doctor, but how long, if a patient does come here and they are available for the study, how long do they have to be available, or does it matter on how bad their condition is?
No, it would be for about a year. We actually are seeing softening of the skin within about 3 months or so, but our study calls for about a year follow-up.
This is great.
Yeah, I mean, it's incredible. Every time you come on,
yeah.
I mean, you're a world-renowned doctor, and it's amazing. I just want people to realize
we get hope that there's the cures and
this is a very challenging condition, and I'm very happy that we are seeing some positive outcome from the studies that we're doing.
Be proud of this because it's in your own backyard. Doctor, thank you so much for coming on and sharing that wonderful
information. Thank you for having me.
Dr. Bahman Guyuron at the Case Medical Center, Department of Plastic Surgery. Please give him a call, 440-646-2167. You can find out if you are a candidate in case you do have a skin condition. Again, thank you, doctor.
Thanks, doctor.